A life lived for others is the only life worth living. It's the quote from Einstein. If you're not going to help people, I'm not sure what else you're going to do. I see with a lot of cardiologists, young patients with normal hearts, they tend to tell people it's nothing to worry about, it'll pass, it's not your heart, things like that, and that's a problem. People always say they can blame stress on a lot of things, but I always tell people there's the problem and then there's the trigger. And if stress is a trigger, so be it, but that doesn't create the problem, so you have to go solve the problem. In terms of issues with passing out, the issue is with the autonomic nervous system. So it's a very complicated issue. The autonomic nervous system is the part of the nervous system that is not under our voluntary control. So there's a lot of balance mechanisms between sympathetics, parasympathetics, and we're not really aware of them. But if you just think about it from a common sense standpoint, just standing up, your body has to make a lot of adjustments. So the issues with this is if the balance of the autonomic system is off, that's what can lead to these cascading reflex mechanisms that lead to passing out, palpitations, bradycardia, all constellation of the autonomic nervous system. So the CLS technology is specifically designed at looking at this. So what it does is it takes a unipolar impedance of the heart, and that will change depending upon the contractility state of the heart. So in the cascade of this reflex system, what you'll see is the initial part, there'll be increased contractility. And then it sets off an increase in the parasympathetics, then the heart rate will drop and things will get worse, and that leads to syncope. What the closed loop system does will sense the increased contractility, meaning that something is going on, and try to override that with pacing before the cascade of the reflex starts. So it can get them through this episode without passing out.